stuff that I need to do. Okay, so I'm going to call the meeting to order. I am going to read the standard announcements to start with. The Mental Health Board, who we are. The Sonoma County Mental Health Board is an advisory board empowered to listen to the concerns of our constituents and to help formulate policies that offer a consistent continuum of care for all those with mental health challenges. We are further empowered to advise the County Board of Supervisors on the mental health system of care. The Mental Health Board mission. The Mental Health Board acts as a community focal point for mental health issues and advocates for the development of a community network to promote the following.
I woke up to
Coalition building that will create a unified voice to impact public policy and awareness, a wider understanding and knowledge of mental health issues, the integrity of mental health services, involvement of clients and families in mental health planning. The Mental Health Board vision. The Sonoma County Mental Health Board collaborates with the Mental Health Services Division of the Sonoma County Department of Health Services to increase public and professional awareness of persons with mental health challenges and to help eliminate the stigma attached to those with mental illness. We strive to positively impact the mental health system by listening to public input and working with mental health services to create policy that will offer hope to families and individuals.
Can you hear me now?
Living with mental illness.
She says yes. I can't hear any.
I don't know what to do. Okay, so I'm going to do the roll call. Bob Cobb, Peterson Pierre, Kathy Smith is me, Marianne Swanson, it's you, Patricia Gray.
I'm not muted, right? Kathy, can you hear me?
Yes.
I can't hear Kathy.
Okay, Tori, maybe
No.
ask her to call in. Peter McElweeny,
Here.
Bob Hales, Carol West, Betsy Chavez, Michael Johnson, and Annabelle.
Hi, I'm here.
Okay. Looks like there's a few people that may still come. So we will put off approving the minutes of the March meeting. We don't have a quorum.
But I can't hear anybody else there.
I can hear you.
What
Quorum
good is it if I
when
can't
we
hear
have 5
them?
people. Consumer Affairs Report. So I know that Kate Roberge could not come, and Michael was going to speak for her. So I don't know. Are you here, Michael? I'm looking. Yes, it's Michael at WCCS. So Tori's going to put you over to, there you are. So Michael, do you have a report?
Yes, good evening. Hi, everybody. So yeah, as you mentioned, Cage is out, and so I wanted to fill you in on what's happening with the peer services as far as I know. So the Interlink is has started this in May is Mental Health Awareness Month, as many of you probably know. They're going to be having an outdoor activity once a week on Wednesdays each week during the month. Those will include art groups and bingo groups for socialization. Also at the Wellness Center, we started a new nature walk group to get folks together where we're still doing distancing and masking, but we're able to be outside and be able to be in each other's presence and enjoy some of the nice weather that's happening and being able to provide support. We're also doing individual peer support outside as well, doing walk and talks and that sort of thing. The Empowerment Center is providing on-site services at Redwood Alliance, doing with the folks that are housed out there right now, and also at the Guerneville shelter. Michael at the Empowerment Center is going and taking some art supplies there, also doing some groups and some one-to-one support. The Empowerment Center has opened, and they are starting to do some on-site services there as well. PPRC down in Petaluma is the new assistant manager there. Cameron is really focused on helping to get peer services into the transitional aged youth groups. He has a passion and a heart for that particular set of folks, and so he's working to provide some services in that area. He's actually talked to Erica, Chloe, and they're working on some ways that they can work together on that. The peer support specialist training that happens that Kate oversees, Amy Breckenridge is the facilitator for that now. That that finished a couple weeks ago, and we got a new group of folks trained and certified as peer support specialists. And the next class will be happening most likely in May. She's taking applications for that now. So anyone that's interested in being trained as a peer support specialist can contact Amy, and I'll put that after I'm finished speaking. I'll put her contact info in the chat for anyone that wants to or knows anyone that would like to do that training. It's a great training. It's a 16-week course where folks really dive into what it means to be a peer support specialist, the difference between peer support and being a counselor, really coming from a side-by-side, coming alongside mindset to help folks and being able to use our own experience and our own lived experience to help folks going through their own challenges. And then also an exciting thing we're doing that all of the peer centers have been working on, and Christy Davila and Tim Miller, our executive director, been working to put together a transitions to housing program. Actually, Miller Phoenix, who you may know, just retired. She was instrumental in getting this going as well. And so what this is called Transitions to Housing. And it's, there's a lot of additional support that we've identified through a conversation with members, other organizations, Catholic Charities, the detention center, lots of different folks who are working to help folks get housed. We've identified some areas that additional support would be helpful, and so what we put together is it's a 12-month-long program providing one-to-one peer support for anyone that's moved into housing, to provide one-to-one peer support, to work through some classes and some different trainings to get the tools that would be helpful, including there's a class called Transitions. We all go through different transitions in life. There's certain tools that are really effective for dealing with the stresses of those. Even when they're positive transitions, there is stress involved with any change. And so we want to help get the tools, self-care tools, awareness, those sorts of things to make that easier. Also, touching on what it means to be a successful tenant, a successful roommate. Also, financial literacy, helping with budgeting, shopping, those sorts of things for folks that need that, and then providing referrals for any other area that they may need assistance, vocational, educational training, anything of that sort, and really providing those true wraparound services, the one-to-one services that no one else in the county is really, no one's program is really designed to do that, and it's not happening. And we've heard from several folks who have cycled in and out of housing multiple times that these services would be helpful. And so we have the program ready to go. Our executive director is now setting meetings with folks to go out and share the program with them and look for funding sources so we can get this going. We want to do a 2-year pilot with it. So there's a year of direct services and then a year of follow-up with folks to see if they're still what additional services they may be needing, and checking in with them and still providing that support. So that's all I have. Unless anyone has any questions, I'm happy to fill in any blanks.
So what were you calling that last program?
It's called Transitions to Housing.
It sounds good.
Thank you. We're excited about it. We've gotten some really good feedback from the organizations we've talked to so far and shared it with.
Okay. Thank you for that report. Anybody have questions for Michael? Okay.
All right. Thank you all for all your work and your support.
Thank you.
Thank you, Michael.
Okay, so do we, is there any public comment? Not seeing anybody with their hand up. Okay, so we're going to move on to our appreciations, and I think, is Erica here today? Looking to see. Yes, she is. So can we put Erica over into the panelist area? So Erica, we were planning on doing an appreciation for you last month and you weren't able to be here. So this month we are telling you how very much you are appreciated. And Tori's putting up the certificate. In honor of your steady service and advocacy for those providing and using the services of Sonoma County Behavioral Health and beyond, your vision of the complexity of the system in its completeness and how it can connect with other health systems has made a huge impact on services in the county. Your advocacy for the humanness of everybody and willingness to be there continues to make a difference, and we appreciate you. I've been working personally with Erica many years, starting back when she was working with Buckaloo for the family services. And I know that she's still doing a group with Katie Swan for families. So her advocacy for families and that group also includes consumers, if I'm right. So her advocacy for people who are experiencing either mental health challenges or those who are caring for them, including family members, is strong and fierce. So thank you so much. Oh, Erica says that Sid does the group with Katie. Anyway, thank you so much, Erica. We sure appreciate you, and hope that you are around for a long time to, so we can keep appreciating the work you're doing. Okay, did you want to say any words, Erica?
Well, I don't like being in the hot seat. Can I hide? I'm gonna hide.
Yes, you can hide. We'll stop video. No, you're just so appreciated that,
Thank you, Kathy. I got teary-eyed when you were reading that. That was really heartfelt and written from the heart and really said something about me. I thought when I saw a certificate of appreciation, I thought it was going to be a generic statement about appreciation. And then as you're reading it, I started to like, oh, okay, now I want to hide under the table.
We'll let you hide, but
I am very honored and grateful to work with all of you and have been for many, many years. And all of you know that this is hard work for me, and this, I was definitely called to be here. So I'm happy to be here and grateful to be a part.
Well, glad you got the call. Mary Ann, your hand is up. You're muted too.
There. Can you hear me now?
Yes.
I just want to give a call out to Erica, who I believe is one of the graduates from the Distance Social Work Master's programs. Is that right, Erica? And it's just
100% correct. I yes, I worked time and was in that program. I remember those days. I often compare now going, well, it can't be that bad.
I just want you to know how proud we all are of you from the National Association of Social Workers, Sonoma chapter. And we have many social workers more now, like you, who are out doing such good things in the communities. And someday, hopefully, we will have a School of Social Work launched at Sonoma State University. It's way beyond due. And I'll shut up now. Thank you.
I would love to see that happen. Actually, that would be amazing.
So I'm going to just real quickly read. Michael from WCCS said, well-deserved praise and recognition. Thank you for being you. And Carol West, Erica, you're a ray of sunshine without ignoring the very real challenges in this world. Always look forward to your inspiring art offerings on Facebook. Me too. Okay, so thank you, Erica. We have, for this month, we have another person to recognize, and she wasn't able to be here, but we are going to give a certificate of appreciation to Barbie Robinson. And Barbie was, she was the one when the behavioral health system was going through real financial challenges. She was the one who was at the helm, and it was not an easy time. And we really appreciated the fact that she didn't hide. She came to our meeting and stood there and looked us in the eye when we weren't happy, and helped everybody get through that really hard time. And then there was the pandemic. So her certificate says, in honor of your steady leadership through difficult times for the behavioral health department and for the county during the pandemic, you showed your willingness to be present when we needed your presence, to respond honestly and openly to our concerns. We want you to know your service is appreciated. So we will figure out how to get that to Barbie. So there we are. Special presentation. So I'm going to let Peter and Bob Cobb take over, and if you have somebody that is going to talk, great. If you know anything about what's happening in the North County, you can let us know that too.
I don't have anyone scheduled to speak today, so.
Okay. Bob, Cobb, did you have anybody?
No, there were several invited, as I'm sure Peter did also. Tori would have been notified if they had indicated that they would be attending. At the moment, I'm not noting any of the invitees that have been able to be here. So I have nothing to add either that I'm aware of.
Okay, and actually, Annabelle, you are our newest member, and you are from up there too, right? Am I right?
Sorry, can you repeat that?
Are you a North County person as well? No?
North County.
Yeah. Yeah, so there's 3 of you. That's news. We now have 3, people up there. I know that we had, I know that last year, Supervisor Gore came to the meeting and was really hopeful to get the mobile support team going up there. And it has started, as far as I know. Do any of you know, Bill, do you know how that's going with the mobile support team in North County?
We're in the midst of hiring the new round of behavioral health counselors who are going to support the MST expansion. So we've reviewed applications and we are scheduling the interviews.
Okay.
I spoke with the Healdsburg police chief, and he initially was interested in having us housed at the police station there. So he was going to look at, creating space. I think that would be a great co-location, is a great way to partner. So I think that will be great. I believe he's retired, so I need to make contact with the new chief and see if he or she is interested as well.
We have a hand raised. There's a individual calling in.
Okay. And you are able to, yes, you're now able to speak, the caller.
Hi, Kathy, it's Becky.
Oh, hi, Becky.
Hi. So I wanted to add something to the Northern Sonoma County report that SOS Community Counseling just this week started its Juvenile Justice Diversion Program with Cloverdale High School. So we will be serving the high school and middle school in Cloverdale. And we have 1 therapist staffed there. And then we also have just signed a contract to open up a mental health clinic at the senior center. So we will be at the senior center in Cloverdale to serve the community, and then we'll be at the high school and the middle school to serve students in lieu of suspension or expulsion, should they be, cited for something like possession of marijuana or something like that. So I just wanted to let you know. And also, since I just heard Bill, Chief Burke hasn't retired yet. He retires next month, so he's still there.
Thank you. I better nail down a couple of desks for us before he goes.
There you go. Nice to hear you all.
It's nice to hear you, and it sounds like you're making a productive expansion up there.
Thank you.
Uh-huh. Okay, so it doesn't sound like we have much more of a report from up there. So, Bill, I'm going to let you go ahead.
As you referenced, Barbie is just about completed her tenure with the county. She's, I believe she's here through Friday. She's not officially leading the department right now. That's been transitioned to Tina Rivera, pending a decision by the board about what they're going to do on an interim basis. So we don't have any information right now on their plans. I would expect there to be, I expect that the county will hire a recruitment firm, and there will be a national search, but they've not said that. Just what I am expecting. We are in the midst of interviewing for a number of new staff positions. As I just referenced, we're adding 5.5 clinicians to the MST program, and then have some other assorted recruitments underway. So we're doing a lot of interviewing and looking forward to new folks joining us here. There's an RFP out from the division for hearing officers. So the division supports The officers who do the certification hearings, primarily at Aurora Hospital, but also we do them at the CSU. So these are the hearings that are part of the LPS process. So when somebody is transitioning from a 5150 to a 5250, for example, there is a hearing, and we provide the officer for that. So we are in the process of that. I think I reported last time, the substance use disorder service system planning process is underway. So we've secured the services of RDA, and they are engaged in a process that is currently involving collecting data that we and others have regarding the need for substance use disorder services. They'll be mapping our current system and then gathering input from the community regarding priorities and gaps in services. They'll put all that information together in to outline what an ideal system would look like. If we have an opportunity to build out our system, for example, by joining the ODS waiver or with Measure O funding support, this report will be what we use to inform much of the decision making. So that is underway. They're in the data collection process, and then we are preparing to enter into a process that will involve a series of focus group discussions, as well as a community-wide survey that folks can respond to. The board accepted our recommendation this morning not to opt into an assisted outpatient program. AB 1976. Let me back up. There is a program, legislation in California called Laura's Law. It's been in place for 15 plus years. That legislation allowed counties to establish involuntary assisted outpatient programs for individuals who have severe mental illness, don't participate in treatment, and have frequent contacts with law enforcement and the courts and frequent hospitalization. Up till now, counties had to choose to opt into that program. AB 1976 changed that and switched it, and now counties have to opt out. Otherwise, they will be automatically enrolled by the state as a county that provides that service. We submitted a recommendation that the board accepted not to opt into AOT program at this time, based largely on a number of factors. One is we're currently in the process of building our full service partnership and our forensic outpatient teams. So we don't want to draw away any energy from those efforts, and those efforts will serve the population targeted by involuntary assisted outpatient treatment. And these programs are, research shows are very effective at this as well. Also, the AB 1976 requires that establishing an AOT program does not draw funding away from other programs and cause the reduction of other services. And we're not in a position to do that at this time. So the recommendation was to opt out for now and reconsider in the future as we look at how the system develops, what our community needs are, and what our opportunities are relative to bringing up new programs. And then lastly, because I'm asked about it so often, I'll share that the psychiatric health facility, the PUF, the development continues. Unfortunately, the opening date keeps getting pushed back. It's just a matter of processes that take time. And so at this time, we are projecting that the program will be licensed at the end of September, and so that it would open in the month of October, and there would be a transition as it ramps up over the first couple of months. So those are the updates I have to offer you right now.
Carol?
I had a question about SB 803 or peer certification, and whether the county has thought about or made any decision on opting in to peer certification. I know that at the California Behavioral Health Directors Association, it seems like there was a decision made to move forward with using CalMesa as a joint effort for those counties that do want to move ahead. So do you have an update on what Sonoma County is going to do or has decided, or when that will happen?
Nothing specific right now. So there's no specific program to respond to at this time. In general, we are interested in opting in, and in general, we are supportive of expanding peer certified services, or bringing individuals into the system who are peer certified as peer counselors or peer support staff. But right now, there's no specific proposition to respond to, and we don't have opportunities right now to expand positions. So we're supportive, interested, and waiting to see what develops.
Okay, so just an FYI, I've been working with the Campro group that's been working with DHCS, and they are about a week away from presenting their recommendations for standard curriculum and, well, all the package, the toolkit that will be passed on then to the counties. So that's about a week away.
Yeah. And I see it as a two-step process. So one is the establishment of I don't know if they're certifying it, or the establishment of a vetted certification program, and then participating in that. And then the next is the state negotiating with the federal government to allow us to bill for those services under Medi-Cal. So I'm watching this with an eye towards the two steps, and how to position ourselves to enrich our services at each step.
Yeah. So just a request perhaps to think about who might be involved at a local level moving forward. And as soon as you are able to kind of let us know, because I think the peer community would very much like to be included in decision making around how that rolls out for Sonoma County.
Okay, any other questions for Bill?
We have a comment from a NAMI representative that she wanted to speak about the Laura's Law. So I'm just going to find her. She went somewhere. Oh, there she is.
Hi, thank you. Bill, I just wanted to add that I think that I totally understand the reasoning behind your recommendation to the Board of Supervisors to opt out of implementing Laura's Law. I get that. The one thing I think is important for future discussion as to whether or not the county opts in or not is a unique aspect of these programs is that family or friends can make a referral to these programs. And in all the other services that we have in this county, outside of involuntarily hospitalizing somebody, the individual has to voluntarily accept treatment or agree to an assessment. And I understand that just because a family makes a referral does not necessarily mean they would be entered into an AOT program, but it does give family and friends who have been dealing for a long time with loved ones who have been repeatedly hospitalized for psychiatric illness, and or been in and out of jail many times, it does give them some kind of a voice to speak to someone and say, my loved one needs to be looked at. And I think that's a missing piece. Also, Laura's Law, it is court ordered outpatient treatment, but my understanding is that in many counties it's called the black robe effect. So that no law enforcement officer goes after that person to insist that they show up for the treatment, but there is an order to give it substance behind, insisting that somebody participate in treatment. It's the voice of families and friends who are so frustrated and cannot get somebody to go to services that I think should not be diminished as the county relooks at it when there's time and funding. So that's what I wanted to add.
So I'm going to comment on that because I am a family member who has had experience with not being able to get help. And my experience is that it's a compliment to law enforcement that they respect a person's rights so strongly that often, excuse me, my voice is gone now when I'm talking. But they respect a person's rights to the point that the person never does get help. And even if family members do, ask for help or call if something has happened, a lot of times it's a matter of, well, you can press charges and I'll take them to jail. But it's hard. It's really difficult to get a person actual mental health help if they are, if they don't have some sort of a mandate. And there's a second piece of it that I'm very aware of, and that is that conservatorship has, in the past when Laura's Law came up, people said, well, there is conservatorship, but if a person is conserved, the housing options for them are extremely limited, extremely limited, to the point where they have to be in supervised housing. And there are such a limited number of places that are acceptable for that. So it's not an answer. It's not an answer. Those people who are conserved can't live in the community. And if you have people living in the community who have some sort of a mandate, then that is, it's an extra protection for people who really can't take care of themselves. So I am finding myself really interested in what Laura's Law is. And I'm hoping that at some point we can, really investigate and know what exactly we're talking about.
I think those are both very strong points. And I'll just add that in a number of counties, Santa Clara County and Sacramento County, I have attended their webinars and their special meetings to explain to the community what is behind Laura's Law. The Sacramento Mental Health Board and the Sacramento Department of Public Health both held community forums. and put out community surveys to get people's opinions. And there were both sides presenting, because there are concerns about individual rights. I hear that. And I hear what you're saying about the lack of housing, although assisted outpatient treatment is not conservatorship. That is a separate level of care. But I still think we have a need to, especially this body, the Mental Health Board, to truly understand what was at the table. And perhaps the right decision may be, say, opt out, but to have explored these issues, I think is something that still needs to be done within this county. So,
Carol?
Yeah, I think that there is two sides to the debate. And I think that's the reason why it has been on the books and off the books over the years. The history was that a young woman was killed by someone with mental health issues. And the feeling was that if he had had treatment, she would still be alive today. That is the origin of Laura's Law. The concern from the peers community is that recovery and therapy needs to be voluntary. And I do understand, I truly do. I am both a person with lived experience myself, and I have a child where we did eventually have to call the police because there was serious issues at home. So I know from both sides that this is a challenging issue. But just wanted to put in the peers perspective. The California mental health peer-run organization, that's a collaborative of multiple peer-run organizations, are adamantly against Laura's Law.
okay.
Kathy, we have two hands. Oh, sorry.
No, that's fine. I don't see the hands. Can you call on a hand?
Yes, we have Debbie Howe, and then we'll have Erica.
Okay.
Hi, I was just curious as to what was the basis of your recommendation to the county to not opt in on the Laura's Law?
Bill, that's for you.
Yeah. So a couple of things. So one is we're still in the process of building our full service partnerships and our forensic programs, which are also designed to serve the population that would be served by Laura's Law. And I feel like we should have those fully built out before we consider adding on an involuntary assisted outpatient program. Additionally, the legislation requires that the establishment of an AOT program or Laura's Law program does not result in the reduction of services. And right now, given our budget status, we can't do that. We would, if we were directed to implement Laura's Law, we would have to pull money out of one program in order to do that. And so we would not be able right now to meet that requirement of Laura's Law. My thought is that it's a reasonable process to continue to build out the programs we're working on and reassess the need for a Laura's Law program, and at a future date reconsider whether or not we want to have a community conversation about whether or not Sonoma will implement an AOT program in the context of our being able to do so. Right now, if we had that conversation and decided we wanted to do it, we're not able to do that as a Department of Health Services.
Can I ask a second question? Is there any cost analysis of what it is costing the county as a whole on the 5150s? For example, in our community in Cloverdale, we've had a severely and persistently mentally ill patient 5150 at least 8 times in the last year, who it definitely does not belong on the streets. I understand not having a facility to put her in, but has there been any cost analysis on what it's costing the Justice Department and these people being put in jail basically, or going to the Crisis Intervention Center over and over again?
So we've not done a detailed cost analysis. I will say though, the dynamics are such that we can't book savings that happen in other areas of the system in a way that allows us to get over the prohibition I described, right? So we can't say we're saving money on this side, so this allows us to reduce another behavioral health program and do this. That doesn't mean the savings aren't happening. It just means the way they happen doesn't allow us to use the money. It was also our estimate that implementing a Laura's Law program just for behavioral health would be about a $1.5 million project. And that doesn't include the additional costs that would be incurred by the courts in the court process, because they too would have to implement new processes in order to manage Laura's Law program. So I don't want to undercut the case that is made for the financial value of the program. Again, there's another side, there's another argument against it. I just am explaining there was no way in that process for us to propose establishing a program now, that we would be able to establish a program now if the community decided and the board decided we were going to do that.
Thank you.
Erica, go ahead.
Okay. Hi, everyone. So I think that it's really great, Bill, that you're pausing with this particular thing. Laura's Law definitely has very different people feel very different about Laura's Law. And there's, research that I've seen that shows that it's cost effective and it's helpful. And then there's other times where it's not. I think that leads to us having to look at our system of care and whether or not our system of care would actually benefit from something like this, and whether or not we as a community feel that it would actually increase access, or if it would just criminalize individuals that have mental health challenges. So I think it would be important to really explore those edges. I get really curious about the IMDT team and access and how that might actually really shift the harder challenging areas where someone's cycling out of criminal justice and the hospital system and not getting the right level of care. I think that there's ways that our outpatient services are getting a lot better and coordinating a lot better. So I think waiting is a really important thing. And also just looking at the Public Guardian's Office and LPS, and how is that not being effective at this point in our community, and what are the ways that we might be able to, in the time when we would take someone's rights away because of safety issues, what is the, how do we make that process more user-friendly across our system of care if people are not, if they're in and out of a 5150, what does that look like, right? So I just, I'm grateful that you're pausing on that and you're really building out our outpatient program so that people have access to care at that prevention level before jumping onto that.
Were there other hands, Tori? Okay.
Sorry, I did see one more. It just popped up. It's
Okay.
Interlink.
Yeah, I was just going on from Carol's queue, going on to the CAMFRO website that has a lot of interesting information that I think would be a good part of this, part of research and confirmation as well. And then they're saying that the problem isn't that there isn't enough involuntary treatment. The problem is that there are not enough person-centered recovery-based services. Outpatient commitment proponents advocate for more involuntary treatment as an answer to the lack of accessible services. And then it states shows a lot of reports from the Surgeon General and other places in here, and pointing out that coercive treatment is ultimately ineffective. The expansion of involuntary treatment will not stop treatment noncompliance, which is viewed as a problem that more forced treatment will solve. In fact, researchers found that forced treatment may cause noncompliance. The Wellbeing Project found that 55% of clients interviewed who had experienced forced treatment reported that fear of forced treatment caused them to avoid all treatment. So yeah, there's a lot of different things to look at for this, and I'm glad you're taking the time to do that. Thank you.
So, any more hands, Tori?
I do not see any at this time.
Okay, so I am in listening to Erica's comment and Sean's comment from Interlink. Excuse me. The way they phrased it was, thank you for taking the time to look at this more closely. So what I am hearing and wanting to happen is the look at this more closely on both sides. I'm not opposed to taking opting out and taking some time, but I would like us to look at what exactly Laura's Law would and would not do, and if it fills holes in the system or not. And I do understand the financial, we can't take money and use it when it's already designated for something that's being done and useful. But I would like to keep an eye on it and understand it better. So that's just me from a family member that's been frustrated. Okay. So thank you, Bill, for your report. Any other questions for Bill? Okay. I did not see Maria here from Piers. So that was next on the agenda. I don't see her here. Okay, other reports, including the COM board and our committees. So we have, we added a committee at the last executive committee meeting, a nominating committee, and I think that they're still working on looking for officers for next year. The PAM committee, Bob Hale is leading it, and he's doing a great job of getting sites for us to visit and actually doing the visits. I went with him to see the program. I forget the name of it, but it's a Progress Foundation. Oh, help me out here. It's the one on Montgomery. Anyway, it was an excellent program. It's a program where the clients are referred from the county. They have to be referred. They can't just voluntarily go there, but it's not locked. And they have a very short stay, actually. It's like a 10-day, I think it's Progress Foundation. I can't remember the name of it. Anyway, it was a really good visit. And the report on that will be coming to the executive committee meeting. He has several more visits lined up. So the jail mental health services, did you have anything to say on that, Carol?
Not other than I was hoping to have a panel of experts, people who have lived experience. That is proving harder to put together than I ever imagined. I have one person that I know for sure would say yes, but I had emails out to 6 others and they have declined. So there is a lot of fear of becoming public, going public with that story. So we may need to kind of revisit that. And
Okay.
so I'll get back to you. Yeah.
Okay. Sounds good. Okay. The QIC meeting is also on this agenda, and I had forgotten that it was going to be on. I know that right now QIC is working on developing a PIP, and the PIP is the performance. Oh, Erica could probably tell me exactly what it is, or Bill.
Is it a performance improvement plan?
Yeah, performance improvement project or plan. And so they're working on that, and as soon as they have that put together, then it'll be public. And I'm thinking that at some time soon we should have an actual presentation on QIC and what they do. So nothing major to report there because it's still in progress. Okay. Board planning. Tori, did we get enough responses on the doodle poll to come up with a date for that? Okay.
No, I believe I only received 3 responses, and I sent out the link again. I can follow up again in the morning with the link.
Okay, so we'll be having another retreat, and it will be probably sometime in May. Look for the doodle poll so you can, if you haven't put your availability in, go ahead and do it. Let me see how many of us are here now. I think I saw Carol came in. So we have 1, 2, 3,
7.
5, 6, 7. Okay, so that's a quorum. So hopefully you've had a chance to read last month's minutes, and I would entertain a motion to approve them. The March minutes. Bob?
I have a question. I would like an explanation on how 7 is a quorum when we have theoretically 15 members or 15 seats. Are we talking about how many are occupied seats versus the full complement?
I believe that's how we figure it on the actual membership.
Thank you.
Because if there were 6 vacant seats, then I mean, we would never, there's a point where we would never reach a quorum. So is that accurate? Is that the way that it should be done? Do you know?
I don't.
Anybody?
Yeah, I yield to someone with other information.
Yeah, I think that it's a quorum based on the number of actual filled seats.
I think that's reasonable to be the number of people that are actually occupying the seats.
Okay, so we can go 2 ways. We can research that and be absolutely sure that it's not, that would be 8 that we would need, or we can go ahead and vote. And then if we find that it's not, that we need to have the 8, we could re-vote when we have 8. So I don't know. Okay, so are you putting your thumb up to go ahead, Bob, now? Okay, so I will entertain a motion to approve the minutes from March. Okay, Carol, is making that motion, and Peterson is seconding it. Okay, we're supposed to do a roll call. So Peterson, are you aye or no? Okay. Yes, Peterson says yes. I say Mary Ann. Yes. Patricia's not here. Peter?
I abstained because I was not present at the meeting, so I can't vote either way.
Carol? Yes. Betsy's not here. And Annabelle? Yes. Okay, so the minutes are approved.
Point of information, I don't think I had a chance to vote.
Oh,
I indicated that I was ready to proceed, but I
Oh,
didn't vote.
I didn't call your name, did I? You were under a piece of paper. Bob.
Yes.
Okay. There we go.
As a point of order, if people were not present at the past meeting, they can't vote to approve the minutes because they would have no knowledge of whether or not the minutes are accurate. So,
right.
And the minutes reflect that both Peterson and Carol were not present. So they have to abstain from this vote.
I'm sorry, I was present at the last meeting. I wasn't present for the entire meeting, but I was present. I participated.
Then the minutes need to be corrected because the minutes indicate that Peterson was not present.
I will fix them immediately.
Yeah, and I believe that I was present. I'll check, but I don't believe I've missed a meeting. I missed the executive, but I didn't miss the regular meeting.
I'll go back through the video and double check the attendance and correct and send out the minutes right away.
Okay, so we will vote again on the amended minutes once we get them. Okay. Okay, so I do not have a report. Most times I don't have any time at all to do a report. So we're way ahead of things today. So I don't have anything more for this meeting.
Carol, excuse me, Kathy, did you want to go over the mental health awareness document?
Thank you. Yes. So Melissa has put together, and her team have put together a list of events that are happening for May for Mental Health Month. So Tori has the list that she can share, and I'm sure that this will be published in some form, but I'm not sure exactly where to, where you'll be able to access it, except here. And so if you can scroll through it so people can see some of the things that are happening. So I'm not sure how this is going to be publicized, how this list is going to be publicized. It's a well put together list. you can see that there are a lot of activities happening. Bill, do you know how this is going to, how Melissa is planning on putting this out?
These are usually posted on the website, the MHSA website, and then I would imagine that that each of these events are sponsored by partners, and I'm sure that they are posting it as well. But I have to say I didn't ask her before the meeting, so I can't confirm any of that.
Okay, so I will also ask her, and if possible, it can be put on the MHSA website. So Interlink says that Melissa emailed it out yesterday. So, and she has a pretty substantial email list. Okay, thank you, Tori, for reminding me that this was available. Any other comments or questions?
Michael has his hand up from WCCS.
Okay, Michael.
Yes, I was just checking in. I know at the last meeting there was discussion about the open board seat and what the eligibility would be for that, and if someone was a part of a county contract, if that disqualified them. I was just wondering if there's any more information about that.
We have put together a flyer that's going to be sent out to the peer services and NAMI as well. And I have some information that I can get to you about requirements for board membership. So I will be sure to get the flyer. The flyer was planning on being sent to you, but I'll get the other information to you as well.
That's great. Thank you so much.
Bob Cobb.
Did other members of the board receive that calendar of mental health month activities? Because I don't believe I did.
Not yet. I'll be sending it out.
Okay, great. Thank you.
Okay, any other comments or? Okay. So I will entertain a motion to adjourn. Nobody wants to leave.
So moved.
Second. Really don't want to leave.
I'll second. Each mental health board meeting is running shorter each month now. Has anyone noticed that?
Well, last month I did it on time, and this month that's really early. So we'll remedy that. We had some really long ones, so
It averages out.
yes, it does. Okay.
Did Peter, did you motion? I'm sorry, I didn't catch who motioned.
Yes,
I saw that Bob.
And Bob.
I moved.
And I second.
Thank you so much.
Thank you. The meeting's adjourned.
Thank you, everyone.